Hi, this is Dr. Karen Perez, and today this video will be about how to study. So I've heard a lot of nursing students says that I can't remember anything. I studied for hours and can't remember anything. So one of the concepts or one of the strategies they use is by reading. Listen, I can't even remember where I put my keys when I come in from inside and looking for it in a couple of minutes. So imagine sitting down reading a whole lot of content in a long period of time or in a short period of time and try to remember it. First thing you have to remember is that NCLEX is not a memory test. It tests you on critical thinking. So one, you want the basic knowledge, yes. But in addition to having the basic knowledge is how you apply that knowledge. So here's some strategies that you can use. I'm a huge fan of recordings and videos. The reason why I'm a huge fan of it is because if I'm driving in my car, then I can listen to it. If I'm in the store waiting in a line, I can put in my earplugs and watch a video. Just like how you go on Facebook, you go on YouTube, you watch pasa video or some video that's going on with some entertainer. You spend the time and look at it. The same way you can use videos and audios for your studying. Okay? So when you're studying, use no more than two items. So if you have a particular website that you use in a particular book, then fine. But don't have these so many resources and you're switching from one to one. It can get confusing if you do. So pick no more than 2 or 3 resources to use as your main staple for studying. Set an agenda or a schedule. So there's 7 days in the week. How many hours you study for a particular day, how many you study for the next day, and set an appointment with yourself for your studying time. If you're going to read and record your reading. Here's why. When you read and record your reading, you have the opportunity to play it over and over and over again. But if you read without recording it, what's going to happen is that you read it that one time, it may stick for a couple of minutes and then you forget it again and you have to go back and read it again. So read, if you're going to read, and record what you read so you can play it over in your car when you're driving. Studying is very important. Understanding the basic concepts of different disease processes and medications are vital in being successful on the exam. But having the knowledge alone is not good enough. I have to tell you, I had the students once when I was doing NCLEX review live, and this student was very sharp. She know all the medication, she know all the disease process, she have the knowledge and the content down pat. Yet still, she came to my review because she was unable to pass the NCLEX. Even with all those knowledge, she was not able to pass. So she had the basic information, she had the anatomy, know what to do, what nursing intervention to do. But when it comes on to critically applying that knowledge, that's where the challenge comes in. So have the basic knowledge, yes. And I'm going to give you an example. See, for example, there is a nurse sitting at a nursing station. She looks at the monitor and she sees a VFib on the monitor. The nurse runs to the patient room. What should the nurse do first? Assess the patient, call a rapid response, defib the patient, administer epi. The first thing to do would be to assess the patient in this situation because there's many things that can mimic VFib. So a lot of times students will run to, defib the patient, shock the patient. But you have to assess first. And even in this scenario, you don't need to identify it because the question did not ask you to identify it on a strip. It asked you, what should the nurse do first? So once you know that ventricular fibrillation can be very dangerous and detrimental to the patient, what would be your intervention? So one of the things is that students see this question and students start being panicky. Oh my gosh, I don't know how to identify it on a strip. That's not what the question is asking you. Don't panic. Here's another scenario. A nurse is standing inside the patient room. The nurse looked at the monitor. The patient has a VFib. The patient is also unresponsive. What should the nurse do next? Assess the patient, shock the patient, defib the patient, administer epi. In this case, it would be to defib the patient. Don't need to assess again. Here is why. The nurse looked at the monitor, saw VFib, looked at the patient is unresponsive. That tells you that she did an assessment because the patient is unresponsive. So there's no need to assess again. You'd want to defib the patient. So there are two scenarios similar. One, the first one did not have that the nurse did an assessment. The second one showed that she did an assessment. So what I'm saying, having the knowledge on VFib, ventricular fibrillation, is good. But knowing how to apply it is even much more critical, which is one of the hugest issues with nursing students. So while you get the knowledge during studying, please understand that answering these questions is kind of fluid. Nothing is set in a stone. I had a student ask me once, do you always assess? No, not always. It all depends on one, what the question is asking, two, what the answer choices that are available. So again, study, always use videos, read, practice questions, look at scenarios. Very good to do those. Apply critical thinking in the process of doing that. And keep in mind that the test is not built in concrete. It's always ABC. It's always assess. No, it's not. So understanding how to apply the knowledge in different scenarios is vital to your success on the NCLEX. Do you want to pass the NCLEX? Please reach out to us at Danvers Nursing Institute and we will definitely help you on your journey in becoming a nurse. Visit us at www.danversnursinginstitute.com to register for one of our NCLEX review. Thank you.